Police dispersed the pre-intern doctors and removed some placards from them as soon as they hit the streets to begin their demonstration. One of the medical pre-intern doctors at Gulu University, Dr. Herbert Ayiko, said it is unfair for the government-sponsored students to be paid allowances, leaving out the privately paid students, yet they will later serve in the same medical facility. He also noted that many medical students have dropped out because they failed to meet their financial expenses.
But as the people from northern Uganda, to beat the competition brought about by other regions, we have to work and study much more longer. So we have strived, our communities, our guardians, our sponsors have pushed us for the 5 years, the 4 years and 3 years. And they're exhausted because they know once you graduate, we have had enough with you, you're now good to go and sustain. When you go for internship, the government facilitates you. Actually, they ask for support from us because now they call us doctors, nurses and midwives. Now, if you tell us we have to pay for a whole year, when we are working on that schedule 24 hours, Monday to Monday, definitely you are marginalizing us.
Another pre-intern doctor, Penina Manunu, said that their parents sacrificed a lot by selling everything to ensure that they go to school.
The moment you are done with the 5-year course, your parents will just be like, now you are done, you are going in for internship. They start calling you doctor. Actually, they'll be calling you doctor, send us something at home. And now you are telling this same person to go to be at the ward 36 hours. To be at the ward 36 hours. So 36 hours they are at the ward. Where are they going to get something to eat? Where are they going to get somewhere like to rent, money for renting? Are they have we reached an extent that we are now dogs or stray animals that now we will have to start laying in the wards and we sleep with the patients? Because we have nothing like even money for renting or even for feeding.
The leader of the pre-intern doctors, Alfred Amanya, appealed to the government to take matters of the health sector seriously and prioritize the welfare of citizens. He added that they are advocating for vulnerable mothers and other citizens because they cannot fly abroad to seek better health care, like some government officials who do so at taxpayers' expenses.
The government already knows that if they don't regulate entry to medical schools, it means the number of medical students will be high. And these are things which they know very well. And I'm very disappointed to say that all the private, even the private universities, they're owned by these officials. And I don't know why they intentionally now want to mistreat medical students, the doctors to be. Right now, as we talk about interns, they're not students. These are doctors. These are doctors. These are doctors. It will be very disgusting even for a police officer to pull me around, you know.
Alan Kasandeke, the president of Gulu University Medical Students Association, cautioned that such attacks on the doctors constitute an attack on the poor communities and the country as a whole which they serve. He also noted that it's the responsibility of all citizens to stand for their rights.
If the health sector is under attack, your child is under attack, your mother is under attack, your father is under attack. These are the people who are going to go to hospitals. And if they don't get this proper medication, they are the people who are going to suffer.
The doctors appealed to the government to deploy the interns, pay them equally, pay the senior house officers or senior doctors to supervise the interns and raise the pay of medical officials, special grade to preserve the integrity of medical profession and avoid extortion of money from the poor by some medical workers.